Good morning and welcome to St. John Ambulance National Headquarters. Last week we did AR or CPR on a baby infant, and this week we're going to look at how you treat choking in an infant. This morning we have Michael Carter with us, who's one of our instructors, so I'll hand you over to Michael.
Hi, good morning and welcome to St. John Ambulance National Headquarters this morning. Like everything else, children are very good at actually crawling around the floor and putting everything that they get into their mouth, which can cause a foreign body airway obstruction. So one of the first things, as following on from last week, what we would like to do is that when you find that a child is actually in a situation where they're choking, you will hear their grunting, you will hear noises, you'll actually see the colour of the child's face changing. Right, they'll be in a very anxious state and they'll be going blue and cynos. One of the first things we'd like you to do is actually look in the child's mouth and see, can you actually see the obstruction? If you do see the obstruction, just try, put your fingers in to pick it out. Do not do a finger sweep like what we do for an adult. Just put it in and try and take it out, right? If the child is still in a distressed state and is still struggling to breathe, turn the child over, controlling the child's head, onto your actually long arm and onto your back, and give 5 sharp blows to the back in between the shoulder blades. Okay, when you've given the 5, turn the child back over again, and at the same time you're going to be looking and observing, have you cleared the obstruction? Is it on the ground? Has the obstruction, is it sitting there to remove the obstruction? If the obstruction is still going on, you would then actually come in between the nipple line of the child or the armpit line with your 2 fingers and give 5 consecutive chest thrusts. 1, 2, 3, 4, 5. Again, we're looking to see, have we cleared that obstruction? If the obstruction is still there, you continue on and you go back to your 5 back blows. So again, you would go 1, 2, 3, 4, 5. As you swing over again, you're looking to see, has the obstruction came out? If the obstruction has come out, then let's reassess the patient and see exactly what we need to do. Thank you.
Michael, will you just show people how you're holding baby slowly so they can see exactly how to hold baby when you turn her over?
Okay. With an infant, it's a little bit different, you see, with an adult. When we're trying to hyperextend the child's airway, right, we need to control the base of the head, right? If we overextend the patient's airway, right, we can actually kink the trachea, which is the air passage, and cause an obstruction. So it's a slightly, just like the sniffing position, right? And you control it with, I control it with my hands underneath, right? So it's a sniffing position there where you open the airway, right? So again, when we're coming over, you're going to actually bring the child along your long arm, and at the same time, you're going to control it with your 2 fingers each side of the child's air passage in the mouth there. When the child is down, you then control, and it's 5 back blows. You put the hand again along the back of the child's head, along your arm, bringing the child back into you, and now you're controlling with your hand underneath.
Super.
And then look, is the obstruction clear? Can we remove the obstruction? If not, we're back to the 5 compressions.
And is doing the compressions, will that help to dislodge something if it's still there?
Yes, basically what you're trying to do is you're actually trying to force the pressure within the chest cavity, and hopefully that the pressure that you're exerting on the chest, that you will actually force the obstruction out of the child's air passage and clear the obstruction.
Super.
So the compression that we're doing on an infant is the same as the abdominal thrust that we would do on an adult? Yes,
exactly. Or if you look at it when we're doing the obstruction with an adult, and it's an obese adult or a pregnant lady, you would actually do the abdominal thrust only where you do it up in the chest cavity, where you'd actually bring your hands around there, and you're doing the exact same. You're forcing the pressure onto the chest to try and force pressure inside the chest cavity to release the obstruction.
Okay, so we keep doing these 5 slaps or compressions until we dislodge whatever the foreign body is.
Yes, exactly. See, when the child is actually choking, so the child is in this frantic state because he's not getting enough oxygen and he is choking, right? Eventually what will happen if you don't dislodge the obstruction, the child will begin and the child will go just listless. The child will just stop. So at that situation, you need to reassess to see, is the child breathing? If the child is not breathing, then you're into a cardiac arrest situation, what you probably covered last week, and then you're doing CPR, and you're going to your basics of just CPR.
Great.
Mick, we know as an adult the universal, maybe Robert, you'll demonstrate this. If you were choking, what would you do to indicate to somebody you were choking?
You'd end up just holding your
Yeah.
thing. You'd be coughing all the time and your face would turn very flush.
Yeah. And a baby wouldn't do that, Mick. So what would people look for?
See, the baby can't actually tell you, where an adult will stand up and do the universal sign there, and he will be actually, like you can ask the adult, are you choking? Right? If the adult says, yeah, a little bit, well, he's actually not choking, he probably has a partial airway obstruction, and at that stage you would encourage the casualty then to actually try and cough it up. Okay? If the adult cannot actually respond to you or speak to you, and the face has gone red or it's going so nose, and you can see all the congestion in the face, that's where you have a full airway obstruction, right? In a child can't tell you that the way an adult can tell you that, right? So what a child will do, you will hear him trying to cough or breathe or grunt. You will hear these noises in the child. You know these noises where you say there is something wrong there, it's not normal. It's these noises that you're going to hear, right? And when you see the child is going to be screaming for oxygen, and he's going to be really distressed, and the arms will be flying. He'll be using accessory muscles, he'll be congested, he'll be going blue. You know, and at that stage, you know, something has to be done, and has to be done pretty fast. So as I say to you, check the airway, can you see that obstruction? If you and then give 5 sharp back blows onto the child. 3, 4, 5. The same time as you're bringing back the obstruction. Is the obstruction dislodged in here? If so, remove it. If not, you're back down here to the actual compressions, and you're going 1, 2, 3, 4, 5. So it's 5 compressions to 5 black blows, compressions, back blows, until you dislodge it. If it's not dislodged, eventually the child unfortunately may go into respiratory arrest, and then eventually cardiac arrest, and then you're back down to your infant CPR.
So the main thing is stay calm.
Yeah, I mean,
easier said than done.
Yeah, it's very easy for me or for you to turn around as instructors and, you know, as professionals to say, yeah, let's stay calm. But I mean, this is not my child. This is your child. It's not my loved one. It's your loved one. We're professionals and we can stay calm. You know, but if you're an adult and if you're the mommy, if you're the daddy, of course panic is going to come in.
Easier said than done.
Easier said than done.
The slide that we're showing is part of the FEC training. When we do our CPR training, it goes through how to deal with a child, how to deal with choking and that type of thing. If you have some other subjects that you would like us to go over, if you drop a note to us on Facebook, and what we will do is on our next session, we will plan that. If you want to go on to a course, you come onto our website, which is www.stjohn.ie, go into courses, and there's a number of courses there, one being our baby and toddler, which is held every second Saturday in the morning and the afternoon. So until the next time, Mick, thank you very much, and thank you.
Bye-bye.
Bye-bye.